Bakit ba when it comes to family planning, babae kagad?
There's one for men.
Yeah, just one. Hi, Dr. Steve Nazareth, your urologist.
And I'm Dr. Katnan, your OB-GYNecologist.
For as long as I can remember, talagang when it comes to family planning, babae kagad. Kayo kagad ang nakasalang sa OB-GYN, di ba?
Yeah. Societal norms kasi, Doc,
Yeah.
puts the burden on women because of the physical attribute of pregnancy. Sila kasi yung sa kanila nangyayari yung pagbubuntis. So actually, if you look at our contraceptions, ang contraceptive methods available, it's mostly targeted to women. I mean, mostly nakadirect sa mga babae, di ba?
Yes.
Daming forms ng contraception. And then there's one for men.
Yeah, just one.
Yeah, yun nga. So, I think we have to change that notion na pang-babae lang talaga ang family planning.
Before, I would think, before I even did practice in urology, I have this notion na, kasi alam mo na, yung mga lalaki, barako, dapat sila yung in control.
Yeah.
Babae ang ganyan, ang kailangan lang kami, don't touch kami dyan, lalaki kami. It's your responsibility as a woman. But, now, as I was practicing, na-realize ko na there's more to it than just that. Some, actually a lot, but will never admit it, takot magpa-opera ang lalaki. Matapang lang sa bahay, pero pagdating sa ospital, wow! Makakita lang ng karayom, Diyos ko, kala mo, hanap na, mananay ko, nasaan na kayo? So afraid. I think yun yung one thing na yung mga natin, ayaw tanggapin. Feeling nila, role ng babae yan, where in fact, if you ask them, kasi takot ako magpa-opera. Ang number one, parang feeling nila mawawala ang pagkalalaki nila. Now, when you do vasectomy, hindi na sila magkakaroon ng erection, no? Tapos mawawala na sila ng gana sa sex, no? So hindi na nila magagawa yung kanilang husbandly obligations. Now, that's not true.
Not true.
Oo.
Okay.
Kasi yung erectile dysfunction has nothing to do with yung daluyan ng semen, no? Which is your vas deferens, kaya nga vasectomy, no? Malayo siya. Yung vasectomy is so superficial, yung responsible for erection is malalim. Never siyang matatouch.
Okay.
And never mawawala yung hormones mo. Wala doon sa vas ang hormones ng lalaki. So yung pagkalalaki mo will stay intact. Yun ang gusto natin malaman, hindi mawawala. And yung when it comes to yung akala nila mababawasan yung ating ejaculation, no? Yung semen, yung pinipigilan natin is only 10% of your fluid. So hindi siya ganun kadami. So yung fluid, meron pa ring lumalabas, wala lang yung similya. Puro juice na lang siya.
Alright. So no decrease in libido. Tama,
Definitely
okay.
none.
Okay.
I think it's high time talaga na diba? We take responsibility. Okay. Na natin na, hey, come on. Your wife has had so many operations and trips to the operating room already. It's high time na us as men pala.
Okay.
Us as men.
Okay.
Us as men should also take our part in this.
Tubal ligation, most commonly known as having your tube tied, it involves cutting, blocking, sealing off the fallopian tubes to prevent the eggs from getting fertilized by the sperm. Kung ikaw, well, actually, if kunyari, natatakot ang lalaki, na may mga fears.
Which is almost always true.
Yeah, which is sinabi niya, well, they were talking, nagkausap yung couple, tapos, medyo sinabi niya yung fears niya na he's not yet very much decided on, getting a vasectomy. Sa mga babae naman, if kailangan talaga ng form of permanent birth control method, you can opt to get a tubal ligation for the following reasons. Number one, if you feel like you've completed your family. If kumpleto na yung family natin, then getting a tubal ligation might be a good choice for you. Okay, but I just have to say, if you're not 100% sure, okay, that you might want kids in the future, I suggest you go for the reversible kind of contraception. Another reason you can opt for a tubal ligation is if, for example, if pregnancy becomes a health risk. Okay? Alam naman nating lahat na yung pagbubuntis, Doc, di ba? May dala yung peligro o panganib sa buhay ng mga kababaihan. But for some women, pregnancy can be a life-threatening condition. Okay? So for women, those women who cannot get pregnant because it might negatively affect their health or put their life at risk, they can go for a tubal ligation.
Sa women, they never had that problem na, baka mawala ang pagkababae ko. Never, no?
Actually, same lang, Doc. It's the same.
Okay.
They have the same fear. Ang isang fear is, the libido will decrease or sexual desire will decrease, no? I will debunk. That's a myth. It's not true. You know, maraming studies or prospective studies that says it's either no change or actually there's a better sexual desire, sexual satisfaction, and even frequency. Kasi nga, you take away the anxiety of an unintended pregnancy.
Yeah,
so
the
actually,
possibility.
the satisfaction is better. Yeah? It's improved.
Actually, yung vasectomy, it can still be reversible. Kaya lang, it has to be done within 5 years from the time it was done. Kasi beyond 5 years, yung chance of yung success is lower. Kasi most probably yung sperm mo medyo hindi na rin maganda. And then the chance na magsara ulit yung phoenix mo na tubes are higher. Okay? But but I do not advise na papaputol ka and then, hindi pala, gusto ko
The same with ligation, tubal ligation. No? I would have to say na it's meant to be a permanent method, but there are procedures that you can get to have it reversed. So, parang sa tubal ligation naman, anastomosis, pinagdidikit ulit. But like,
I would presume it's more difficult.
Yeah. Similar to what Doc Steve said, it may not always be successful. It can be done, but it may not be always successful. And the success rate will depend on several factors. Number one, kung paano ba pinutol yung tubes. Kasi, tapos kung gaano pa kadami yung remaining fallopian tube. And then the age.
You can choose for how long
Yeah, there are different techniques on how you do it. There's clipping, there's parang tying, ganyan. So also another factor is the age of the woman, tapos the overall health and fertility of the woman. So meant to be
rin pala, no? Kasi yung sa meron ding clipping lang.
Yes.
And then there's just tying lang and then the usual na It's basically the same then.
It's the same. It's permanent, but can be reversed, but not always successful. So it's crucial. It's very important if you're going to decide on a permanent birth control method, whether it's vasectomy or a tubal ligation, you have to be 100% sure. You have to talk to your healthcare provider thoroughly, para just to ensure na it aligns with your long-term reproductive goals.
A lot of vasectomies are done outpatient.
Yeah.
So, like it's a 30-minute procedure. You go in, you have it done, you go home
Safe.
Afterwards. Yeah, very safe.
Effective?
Very effective. More than 99%.
Okay, the same. Okay? Tubal ligation, very safe. Okay? Effectivity, very effective too. The risk for difficult surgery ba, Doc? Surgical risks?
Kasi pwede nga siyang done under local anesthesia.
Yes.
So, kasi yung vasectomy, yan sa testicle, sa scrotum. So, nakakapa doon yung vas deferens. So, you can easily, feel it and just cut it from there. Nip it, konting local anesthetic na. Okay, fine.
With surgical risk, I would have to say baka mas maganda ang vasectomy because I think, tubal ligation, you can have it done right after vaginal delivery or a cesarean section or after a period has passed from your delivery. So if you do it like that, it's an abdominal surgery. It's tiny incisions, pero as compared to a vasectomy, which is local lang. Ito kasi you might have to be placed under general or local, general anesthesia because there might be more risk with a tubal ligation as compared to a vasectomy.
So, main difference is the anesthetic.
I think so.
Oo.
And the incision, it's an abdominal surgery. There, Doc, it's a tiny clip.
Oo. Kasi yung iba na talagang takot sa sa pain, we can do it under sedation lang. And then local anesthetic.
So maybe surgical risk, let's go vasectomy.
Vasectomy.
I think,
with gusto mo. Oh.
Ito, i-debunk ko na to, cancer, they are saying na parang after tubal ligation, there's an increased risk of cancer. Actually, it's a myth. It actually, there are studies out there saying that some types of ovarian cancer are derived or originate from the fallopian tubes. Okay, so by doing a salpingectomy, or by completely removing the tubes, you actually lower the risk of having those types of ovarian cancer. So in studies, a tubal ligation can decrease the risk of ovarian cancer. What else? Endometrial cancer and actually colon cancer pa nga, Doc. So I think yun, no? So myth yun. Sa inyo, Doc, parang cancer. Testicular?
Kasi yung usual lang tinatanong is, will it lead to testicular cancer or prostate cancer? It has nothing to do with any of those. No, not at all. Oo. Yung prostate, it's mostly if you have like a relative who has, and sometimes age in itself, whether you do vasectomy or not. Lalong-lalo na pagka-testicular cancer, definitely walang kinalaman. So, yung cancer part, no, definitely not. I guess both of us would agree na it's high time na our male counterpart would think of doing yung vasectomy din as part of yung family planning. Not necessarily you have to, but at least pag nag-usap ng mag-asawa, bring it there.
Yeah. They can that should be an option too. Yes.
Yung ngayon kasi I feel like nowadays more accepting ang mga lalaki in these procedures. I'm not saying that they will agree, but at least they accept it more. Okay, yun. So kasi ang baba pa rin ng vasectomy as compared to tubal ligation.
In the Philippines, to?
Yes, in the Philippines.
Okay.
Hindi naman ito isa lang yung magdi-decide.
Yes.
Diba? We have to plan it, we have to discuss it, we have to make a really good decision as a couple.
Napakasimple lang kasi, Doc, bakit kailangan it should be shared. Having kids will have an impact or consequences for both. Okay?
Yes.
So, for both the woman and the man, so dapat shared yung pag-decide whether to get family planning.
Would like you to know that if you want to do vasectomy, please visit us, your favorite urologist. We have a lot here in Makati Medical Center. Just see any of us.
Okay, and for women, your obstetrician gynecologists are available in Makati Medical Center. If you need help or support in deciding kung anong klaseng contraception yung kailangan and appropriate for you, you can just come visit us here.